So I'm really thrilled today to have wrangled Dr. Lauren Harshman for an interview. Dr. Harshman is an assistant professor at the Dana-Farber Cancer Institute, focusing on kidney cancer. And I have to tell you, if I had to put my bets on the one person that's going to cure kidney cancer within the next 30 years, I'm going to put the onus on her. I think she could do it. So Lauren, thank you so much for joining me today.
Thank you, Monty. It's a pleasure to be here.
You know, one thing that we always talk about from day to day in the clinic, and many of my patients have actually brought this up more recently, is whether or not there's any biologic marker that we can use to identify those patients that might benefit the most from PD1.
Yeah.
Any hints towards that at this meeting?
Yeah.
Can you give us your thoughts?
I think the jury is still out on what we call a predictive marker. Do we have something that upfront can tell us whether the patient's going to respond to that therapy? That means that we would ensure that the patient responds and we eliminate any futile toxicity in a patient that's not going to have a good response to this drug. One potential marker that has come up and has been looked at in multiple studies and with multiple different PD1 blocking drugs has been tumor tissue PD-L1 expression. So if you take the patient's tumor and look at it, do we actually see that it's expressing that protein, that PD-L1 protein? And I think that collectively we have actually seen, not only in RCC but other solid tumor types, that in patients whose tumors express that protein at higher levels, and that's a whole other definition that we're not quite sure about, that those patients have a higher chance of response. It does not mean that they will definitely respond to the PD1 blocking agents, and it also doesn't mean that if a patient's tumor was negative that they won't respond. So I think there's definitely some data there, but we are not at all at the point where we would say that because your tumor is negative, we would not give you this drug.